Hey, this is Joe Heiler from sportsrehabexpert.com, and today we're going to do some dry needling for the Vastus Lateralis. And one of the main reasons for doing this, maybe not so much for the trigger points as we've done in some other videos, although trigger points in the Vastus Lateralis are known to refer down to the lateral knee. So patellofemoral pain, lateral knee pain, distal IT band symptoms, things like that can definitely be related to that. I don't find active trigger points as often in the VL as I do a lot of other muscles though. But one thing I really find is that muscle is high tone very often, and what you're usually going to see is someone that has a positive adduction drop test, like one of the PRI tests, where that vastus lateralis could be part of the reason why they cannot adduct that leg. In addition to, in PRI, they're looking at anterior rotation of the pelvis, but toning that muscle can be a big part of that as well. So maybe if your hip lift corrections aren't working well enough, doing some manual therapy through the VL might take care of that. Also, where we see it a lot is Thomas test, when the leg is adducted, or tightness through here. A lot of times you'll see as that leg comes off the table, the way it pulls on the tibia, it'll externally rotate it excessively as well. So lots of reasons for addressing the VL, not just the trigger points, but taking the tone out of it can be very beneficial. So in the next couple of videos here, I'm going to show you how I would dry needle. We'll hook it up, do a little bit of e-stim with it, and then we'll come back and we'll retest her adduction drop test. But for now, we'll just get a quick look at her adduction drop test. So maybe come up just a little more. So got her about 90 degrees. Okay, I'm just going to bring that top leg back, stabilize her pelvis, get her to full extension here, or neutral extension, and try to drop that knee, and right about there is where we run out of room with her adduction. Okay, so we'll come back and test that after our dry needling. Okay, so now in this video I'm going to demonstrate trigger point dry needling for vastus lateralis. And usually in the VL you're going to find some trigger points down at the lower end and some right in the middle. Occasionally you might find something a little higher up, but I'm just kind of looking for those spots that kind of snap and roll. There's some pain associated with them as well, and usually a couple of needles is plenty to just get them in there. I can do a little bit of pistoning to try to get a twitch, and then I'm going to go from there into just, we're going to do a little bit of stem on them here. Big twitch there. And with the stem, just going to get it going 2 beats a second. Normally it'll go for about 10 to 15 minutes. Some of the research says up to 20 minutes is a good amount of time. Just enough to get the muscle jumping, but still be fairly comfortable. So you should feel in just a second here. You okay with that much?
Yep.
Okay. So we're going to let this go for about 10 minutes, and then we'll come back and recheck our work. So we just took out the needles. We just did stim for a few minutes, in this case, just to kind of get things to relax even a little bit more. And then we're going to go back and check her adduction drop test and see if that's improved at all. So go ahead and bring those knees up a bit. A lot of times what you'll notice right off the bat too, like it's just a lot easier to bring them back into extension, and then look how much easier her leg drops this time. Much easier, right?
Mm-hmm.
So now ideally, like we were just talking about, I mean, I would, if time permits and the patient's okay with it too, definitely hit the glutes, glute min, glute med in a couple spots too, would just make this an even stronger fix in my opinion. A lot of times, even if someone struggles to get that adduction, even going through some of the PRI stuff, I think this is just great to help with that. Or in the case of some of our patients, you can see how quickly this fixes it, but at the same time, like, I'm going to follow up with a 90-90 hip lift. I might put her on her left side, and we might do some of those knee toward knee type of exercises and have her actively try to adduct and internally rotate that leg. So the VL is a great place to work, especially for these people that fall into these PRI type patterns of not being able to adduct that hip. I definitely see it more on the left than the right, just like you normally would, with the PRI stuff. But sometimes you're going to see a PEC pattern person who's stuck in extension on both sides, both anterior pelvic tilt on both sides. So you may have to do this on the right side as well. But great for taking care of a lot of lateral hip issues, a lot of lateral knee issues as well. People that have single leg stance problems, a lot of times they can't stand with a level pelvis on this leg because they can't adduct, so they're going to find some compensation. She doesn't do that because we checked. That would have been a cool thing to see too, but sometimes you'll see that, and this can help to fix that right away. Okay, so that's what we'll do with the VL in a lot of cases, and give it a try.